One of my proudest moments I love to do is when I get to sit down and talk to the new employees of the HR Service Center. The men and women who are actually the phone call agents at our contact center. And the reason I enjoy talking to them and instilling to them the importance of their job and role in the organization is they are the first point of contact that our sailors and veterans have when they speak to the agents and they need to get an issue resolved. They have the important job of setting the tone, and first impressions mean everything. And just to instill that into these new employees is vital in the role as customer experience, because customer experience with the My Neighbor Career Center starts with them. And as part of the customer experience office, myself and my team, we instill that we have professionalism from the beginning to the end, and being that they are the first point of interaction with the sailors, it is vital that they get that right. And we go through some concepts of customer service, customer experience. We also talk to them how to de-escalate phone calls when customers call in that are upset because their cases or their issues haven't been resolved. We talk them through that. We give them basics of phone call etiquette, customer experience, how to do de-escalation, and just overall improving the customer experience for the sailor veteran when they call in for the first time at My Neighbor Career Center.
Hi, I'm Mike Zarlenga, Credential Modernization Program Manager at Defense Manpower Data Center. And on behalf of the Uniform Services Identification Card, or USID card, online renewal program team, I want to express our sincerest gratitude to the selection committee for honoring us with the Service to the Citizens Award in the category Building a Customer-Focused Culture. We would also like to congratulate the other award winners and are humbled to be included in this prestigious group. Thanks to the team's collaboration, dedication, and commitment to serving our citizens, we were able to deliver this exciting capability that's had a direct, immediate impact to members of the public.
Since inception, we have helped over 100,000 DoD ID card holders receive their new ID card in the mail. No visit to base and no waiting in line required.
We're thrilled that this capability is meeting and exceeding expectations. We're proud to support our service members, veterans, and their families, and are honored to be recognized among the winners of this year's Service to the Citizen Awards.
Over the last 2 decades, HUD has worked to make the FHA Resource Center a first point of contact for housing questions. They launched HUD's first hosted online FAQ site and expanded services to include HUD's National Servicing Center and support for HUD's disaster recovery, multifamily housing, and Office of Healthcare Questions. The FHA Resource Center is grateful to those nominating them and to the Services to the Citizens Award Committee for this prestigious award.
Y'all are amazing. You have been delivering month after month, day after day, real and innovative changes that have positively impacted the lives of countless families and individuals across the nation.
The best part about being with the FHA Research Center and this team is I get to deal with all aspects of HUD and all different types of customers, and I learn something new every day.
The proud moments for me come when I think about the ways that we've been able to embrace technology and really bring housing resources and information to the American people, allowing them to access that when and how they choose. Just knowing that we're making a difference and changing our processes to assist them and address their concerns in real time.
One of the greatest accomplishments have been with the innovation of the service delivery to our citizens and industry partners. Our team continues to improve the contact center IT technology that supports the FHA Resource Center project, along with the processes our staff utilize to deliver these services. Our ability to listen to the customers' feedback provided by our customers allow us to improve the service delivery of this project.
Thank you so much for this tremendous award. I am deeply honored and grateful to the committee and to everyone who nominated me. Reflecting on my long career with the IRS, I'm proud of the numerous projects and process improvements we implemented. In every improvement effort, I always ask two simple questions. How will this help the taxpayer, our ultimate customer, or how will this help our employees serve taxpayers better? Encouraging our employees to focus on these questions helped underscore the importance of making a meaningful difference for American citizens. Our work in establishing online accounts, enhancing identity theft victim assistance, and improving correspondence processing are just a few examples of how we work to elevate the customer experience. However, the effort to enhance the level of service on the main toll-free customer telephone line stands out as the most impactful achievement. The LOS measure is widely published and used often as a benchmark for evaluating IRS performance. With the substantial funding allocated to the IRS under the Inflation Reduction Act, demonstrating our ability to effectively use these funds and potentially retain them hinged on our capacity to deliver a high level of service. The year before receiving the funds, the filing season LOS was only 15%, which was significantly affected by the COVID-19 pandemic and the legislative actions needed to support the country's recovery. The IRS faced overwhelming demand for services. To address this, we emphasized the critical importance of improved performance across the organization. We collaborated with the human capital to rapidly onboard additional customer service representatives, received enhanced telephonic and computer support from IT, and detailed employees from other functions to support the heavy demand. We refined our monitoring techniques to adapt to customer needs and kept everyone engaged with regular updates on our progress. Our collective efforts paid off significantly. The LOS improved from 15 to 85% during this crucial filing season. This remarkable turnaround demonstrated to the external stakeholders that with the appropriate funding, the IRS could deliver exceptional service. I am most proud of this achievement because it reflects our ability to engage everyone in making a substantial difference in the lives of taxpayers in the future of the IRS organization. Thank you all once again for this honor and your support.
I'm Rob King, and my team and I are proud to talk to you about our work at the IRS. The IRS Individual Online Accounts web app allows citizens to access tax information in one spot, securely and quickly. Everything from checking your tax balance to making payments to live chat features is now available at your fingertips.
Let's not forget about the real-time tracking features. Being able to see the status of your tax refunds being processed. It can really ease the stress during tax season. Another example is the ability to view certain audits conducted by mail digitally for the current year and past 6 years, and closed audits within the last 3 months of the current date.
There's more to individual online account than just convenience. It's tailored to provide direct guidance and the tools you need to understand your tax obligations.
Since launching Individual Online Account, our digital features like viewing notices and letters online have not only cut down on paper, but have also made resolving issues faster. Plus, with our new live and virtual chat features, we're able to connect directly and solve taxpayer queries faster than ever. Additional features allow users to seamlessly access transcripts and get an identity protection PIN that provides taxpayers with an additional layer of protection against fraudulent tax returns.
In short, Individual Online Account is more than just a web application. It's a leap into the future for taxpayers. We're incredibly proud of the impact it's had and the positive feedback from all of you. It's an honor to celebrate this milestone with our hardworking team. A huge shout out to everyone who has made the convenience of the digital age accessible to taxpayers and been part of this journey. Thank you for this award.
My name is Evan Davis. I am the Training and Engagement Lead with the VA Mercer team at the Department of Veterans Affairs. and I work with virtual reality and extended reality in VA. I help get that spread across the VA healthcare system. But one of the most exciting parts of my job is to be able to interact with veterans, advocate for veterans, and really give them an experience that's tailored to them. And, ranging from anywhere from pain management to stress and anxiety reduction. But one of the coolest ways that I've seen through this technology and my ability to do what I do is I had a veteran at a creative arts festival that I was just trying to give some sort of stress reduction to with a virtual reality headset. And when the veteran took off the headset, I wasn't prepared for how it affected them, but the individual shared that through this technology, this was the first time in 25 years that they were able to see how they used to. And for me as a veteran, that's some of the most proud moments I have, is to be able to create those spaces for veterans and those opportunities for them to be engaged in their healthcare.
Hi, my name is John Pruett, and I'm the Acting Director of Experience Analytics and Measurement and a Senior Customer Experience Strategist at the Department of Veterans Affairs. I'm honored to receive the Service to the Citizens Award, and congratulations to all of this year's winners and nominees. My journey began in 2005 as a broadcast journalist in the United States Army. Adrian Cronauer, who was portrayed by Robin Williams in the movie Good Morning Vietnam, once said, "Your job as a broadcaster is to see everyone else's job and to tell their stories." And that really inspired me. But over time, I realized that there was a missing and critical element from that synopsis: empathy. Telling someone's story requires feeling their experience and walking in their shoes, even when we can't fully understand their journey. And this realization led me to roles in operations, systems redesign, human-centered design, and experience measurement. And in these roles, customers have often come to me with serious issues, hoping for solutions. One memorable story is about a veteran who was diagnosed with life-threatening cancer and was initially ineligible for VA healthcare. By empathizing with his situation and advocating for him, personally walking his packets through each stage of the process, I helped to secure his care, and when we last spoke many years ago, he happily reported to me his remission. At the VA, I've had the privilege of connecting countless customers with solutions and working with incredible teams to create system or enterprise-level impacts for thousands of veterans regionally and millions of veterans everywhere. So thank you for this award and the recognition, and let's all continue to make the government work for the people we serve.
Hi, my name is Nick Hall, and I'm a principal at Deloitte, and more importantly, I'm a veteran and a mum. I'm so honored to receive this Service to the Citizen Award. My role at Deloitte is to support our government clients in implementing people-first customer experience programs and practices, and making sure that the intended value of a program, a product, you name it, is delivered to those that need it. And I get to do that day in and day out with the VA, which of course is very dear to my heart. You know, customer experience has always been front and center for me. I think being an Army non-commissioned officer, you are wired for this. It's very basic. Take care of your people and be authentic. And it was this ethos that's translated for me into the private sector. Since leaving the Army, I wanted to continue to dedicate my life to service, and have been able to do that through my work with my government clients to make sure our veterans' voices are elevated and acted upon. Customer experience really is an extension of my mission. Outside of my client work, I've been able to design and support a number of programs to support our veterans, including personal health and recovery events at the VA, where I get to lead Deloitte support. My favorite is being able to help our veterans get up on surfboards during the National Veterans Summer Sports Clinic. And also veterans education. With my current program, Women's Employment Bootcamp at Deloitte, WeBC supports women veterans and helps them parlay their known strengths and discover new ones. And by doing this, they really start to rediscover themselves. I'm honored to continue to support the mission in whichever way I can, and most importantly, continue to help others find ways to serve. Cheers.
Our mission at Vote.gov is to make it easy for all eligible voters to understand how to register and how to exercise their right to vote. Vote.gov provides accurate, official voting information from the U.S. government to the American public. In March 2021, President Biden passed an executive order on promoting access to voting. This EO tasked GSA to improve the user experience of the Vote.gov website. In the summer of 2024, we launched a refreshed website with expanded content and accessibility features.
Because voting happens at the state level, we direct people to their state election websites to register and find state-specific information. The executive order called on Vote.gov to help people navigate the whole voting process, especially if they experience barriers to voting. Our new content provides answers to real questions and challenges we heard from people in our user feedback and research sessions. We also provide voting information in many languages so that eligible voters with a low English proficiency can confidently participate in the democratic process. Vote.gov started as a bilingual site in 2016, available in English and Spanish. Today, we cover 96% of the American public by offering 18 languages, with more on the way.
The Vote.gov team is committed to accessibility. We work with disability advocacy groups representing people with limited vision and hearing and difficulty operating computers, and we've integrated their feedback. We added text magnifying and high contrast features. We built the site so it's compatible with screen readers, speech recognition software, and other assistive technologies. We're continually improving the site based on what we hear directly from voters. We're committed to helping every eligible voter get the information they need to exercise their right to vote.
I'm here because I helped create a digital service team at an agency. And in a way, when you lead a digital service team, your employees are kind of your customers because you're helping put them in a position where they can do something they're really good at and have other people carry the load for everything else. Early in the life of digital service at CMS, we collaborated with John Booth and Mary Wallace, who also won awards today, to launch a website and form that helped people understand their rights to an estimate for medical treatment and what to do about it when treatment costs more than the estimate. It's a complicated problem. And I helped the digital service team scope the problem, figure out our approach, and staff it before leaving for parental leave. And then for 3 months, I was gone. And when I came back, I was not at all surprised to see the team had done a good job. But I was very heartened to see that they had done a better job than I would have. And as a leader, nothing makes you happier than seeing you hired people who are smarter than you and did a better job than you would have. That website has now helped thousands of patients, and it is still online at cms.gov/medical-bill-rights.
Hi everyone, my name is Aditi, and I'm on the EMedicare team at the Centers for Medicare and Medicaid Services. More than 5 years ago, we launched the EMedicare Initiative to improve the digital customer experience for over 66 million seniors and people with disabilities who get their health insurance through Medicare. That includes about 10,000 new people who enroll in Medicare every single day. Through eMedicare, we revamped Medicare.gov. We rebuilt the popular Medicare Plan Finder, consolidated 11 standalone facility tools into a single new Care Compare experience, simplified content and navigation, added live chat, and made sure all of it was mobile optimized for anywhere, any device access. For those enrolling in Medicare, the team launched Hello Medicare, an integrated research-based project to make sure newcomers had everything at their fingertips to find answers and make reliable, confident decisions about their health coverage and care. This included providing extra attention for first-time callers to 1-800-Medicare and creating an annual digital campaign and an expanded email campaign to be sure new enrollees knew what to expect. Through eMedicare, we also launched an online premium payment option to serve the 3.4 million people who pay their Medicare premiums directly. And we're thrilled with the results. Increases in customer satisfaction, record-breaking website traffic, and strong email engagement rates based on healthcare and government industry standards. We're humbled to be recognized for this work, especially because serving the citizens was exactly the point of it. On behalf of the entire eMedicare team, thank you for this honor.
I'm excited to share that after more than 2 years of work, FEMA has successfully implemented the Streamlined Registration Intake process. Streamlined RI is a smarter way for individuals and families to register for disaster assistance with FEMA. This was a huge project made possible thanks to the contributions by many people and organizations inside and outside of FEMA's Recovery Directorate. However, our Recovery Technology Programs Division was central to the technological advancements needed to achieve success. Through innovative field work, the team reimagined how FEMA could best serve the end-to-end user needs to help survivors after a disaster. The user experience team deployed to the field multiple times and used their on-the-ground research to evaluate and refine the application design, continuously iterating and improving. They met survivors where they were, saw their struggles, and worked hard to deliver a better experience. We know the days and weeks after a disaster can be extremely difficult time for people, and Streamlined RI is another way FEMA is easing the burden on disaster survivors. With this new process, each application will be automatically tailored to the person's specific recovery needs, only requiring information that is relevant to their situation so that we can improve the most assistance possible to them without any extra burden. Additionally, potentially confusing and redundant questions have been rewritten to help applicants more clearly communicate their needs to FEMA when applying. The new process has 25 fewer questions related to home damage assistance. Those changes have led to dramatic decreases in the time it takes survivors to complete their applications. That means we are able to help more survivors more quickly and get them on their road to recovery. We are extremely proud of this innovative solution and the benefits it will bring to disaster survivors, and I'm honored to join in celebrating our Recovery Technology Programs Division with this distinguished award.
On behalf of U.S. Citizenship and Immigration Services, thank you for the esteemed pleasure of being a recipient of the Service to the Citizen Award. Our agency is committed to providing exceptional service to the millions of customers seeking immigration benefits and services annually. And one of our many priorities is customer service support. Following me, you will hear from two of my colleagues who will discuss a few of our new digital tools and how they are improving the customer experience.
Access is being recognized for our tenacity in looking for ways to enhance the customer experience. And one of those tools that we have developed is the change of address on our online account. That change of address is for customers who have pending applications or may not have pending applications. And it's very straightforward. The applicant logs into their account, they're able to update their biographic information, they are also able to edit their mailing and their physical address. And they're ready to review and submit it. It's very straightforward. And as a daughter of an immigrant, I know firsthand how stressful this process can be. So I appreciate working on forms such as this one that relieves that stress and anxiety for our stakeholders.
I work directly with our customers in large engagements and also one-on-one when they need more guidance or want to ask a directed question. These interactions build trust and customer confidence. Another way we build that confidence is by giving customers tools they can use to take an active role in the management of their applications. With personal online accounts, they can view the progress of their applications and update their account details on their own schedule whenever they feel they need to. One of the tools we have given customers is the ability to change their appointment for fingerprinting and photographs. They can choose a date and time that is most convenient for their daily lives, and they can also choose the location. If they are traveling or visiting family in another city, they can choose to have the service provided at the facility closest to them. When we give our customers the ability to make choices and decisions, it provides a much better experience. And I feel like we're really making a positive change in the world and in the lives of our customers.
Hello, my name is Michael Gross.
And I'm Leslie Sheffield. We are with the Office of the Chief Information Officer at the Department of Labor. We're so honored to be recognized as part of the team, along with our colleagues Akanksha Sharma and Ramki Sakalingam, for excellence in delivering digital services.
As we all know, the pandemic has brought a lot of challenges, especially for state workforce agencies who need to support their unemployment insurance programs. One of the biggest challenges is ensuring that everyone has equitable access to fraud prevention mechanisms.
To address this issue, the United States Department of Labor recognized the importance of providing a shared service ID verification program that states could participate in at no cost and with minimal technical impact to the states. The Department of Labor, or DOL, created a systematic approach to onboarding states that minimized the technical lift on states' infrastructure. This department-hosted shared service allows participating state claimants to complete ID verification for their unemployment insurance claim, either digitally with GSA's Login.gov or in person at a participating United States Postal Service location.
The best part is that Department of Labor covers the transactional cost of ID verification for state partners for a 2-year period. And we provide technical resources to assist the states in their integration journey. We're extremely proud of this program, and to date, more than 300,000 individual UI claimants across 14 states have benefited from this service. This program allows states to quickly confirm the identity of individuals and gives claimants an equitable path to validate their identity in a timely manner and gain access to much-needed unemployment insurance benefits. Thank you again for recognizing our commitment to delivering this important service to citizens who need them.
Hello everyone, I am Kelly Gravely, an IRS employee. I don't have one particular moment to share with you that I'm proud of. However, I've worked in the digitalization transformation space for over the past 5 years. I am very proud of all of the work that's being done by our dedicated employees to bring functionality to the agency that is allowing us to modernize, alleviate many manual, burdensome processes, and handle less paper. This is not only making jobs easier for our public-facing employees, but also the ultimate end user, our taxpayer.
Hi, my name is Myra Fullerton, and for the last 17 of my 35-year career, I've worked for the federal government, the IRS. I'm humbled and truly grateful to be on this year's recipient list for the 2024 Service to Citizen Award. And as I look back over my career, there are a couple of experiences that really represent the ways that agencies come through for the American taxpayer. Being on a leadership team during the COVID pandemic and continuing operations was truly transformational. We knew we were doing work for the American taxpayer that really mattered. And over the last year, I've worked in a leadership role to help deliver digitalization services to the American taxpayer.
I'm in the Enterprise Program Management Office. I'm privileged to serve as one of the executive leads on the IT Digital Transformation team. I've been with the IRS over 14 years, so I'm deeply honored to accept the Service to the Citizen Award. The recognition is a testament to the hard work and dedication of every individual on our team.
Hi, my name is Angela Render, the Chief of the IRS.gov Content Strategy Branch in the Office of Online Services at the Internal Revenue Service. I have the honor and privilege to speak on behalf of an amazing team of people at the IRS who are passionate about serving the public. Filing taxes can be intimidating, complex, and overwhelming, especially for someone who has never filed before. To try and alleviate some of that stress, the First Time Filer Journey team took a bold and innovative approach to the IRS's public-facing website. The team was made up of 43 people from across the IRS, including content strategists, editors, information architects, analysts, tax law experts, user experience researchers, designers, communicators, web publishers, and programmers. In the realm of customer experience, looking at how people interact with processes and technology through the steps in a journey is a proven approach. This team applied that approach for the first time to the most visited IRS.gov web pages, rewriting and restructuring the information to guide people easily from step to step. IRS.gov is one of the most heavily trafficked federal websites with an average of 3 billion page views per year. Reworking the highest demand pages required the courage to trust the data, take calculated risks, and try something new in a space where failure could mean reduced customer service and a negative impact on public trust and confidence in the IRS. We will incorporate the measurable success of the first-time filer journey into other journeys the public takes when interacting with the IRS. The team will also iteratively measure and improve on past successes to significantly improve the customer experience on IRS.gov by making content easier to find, use, and understand, because the journey is never over.
Hi, this is Erik Markow. I am the IRS IT Director responsible for taxpayer account and notice processing. Thanks to the Inflation Reduction Act, we have had the funding to transform the IRS in a lot of great ways. My proudest moment this year has been in leading the IT team that has simplified the IRS notices to make them easier to understand, and leading the team to ensure there are digital copies of IRS notices available online. IRS currently mails about 170 million notices and letters every year to taxpayers. I'm very proud for leading the IT team that transformed the IRS to provide now over 50% by volume of notices to taxpayers' online accounts. And by the end of this year, we will increase that to over 80% by volume. Just one IRS notice improvement in wording or digital delivery has proven to significantly reduce the need for taxpayers to have to call the IRS. And that's what we all want, right? So I challenge all of you, go to IRS.gov. Check out the new exciting features we have available for you all. I want to thank everyone at Service to the Citizen for this award, and my amazing Maximus team partner in this critical and much needed IRS notice digital transformation for our citizens and taxpayers. Thank you.
Hi, I'm Neil Evans, Chief Officer for the Office of Connected Care within the Veterans Health Administration. I'm honored to be a recipient this year of the Service to the Citizen Award. This recognition is not just a reflection of my efforts alone, but a testament to the dedication of countless individuals who work to serve veterans. As we celebrate this achievement, I'm reminded of the impact telehealth has had on veterans. Over the years, we have witnessed the expansion and power of technology that enables us to deliver accessible, high-quality healthcare to those who have sacrificed so much for our country. Today, around 40% of veterans enrolled in VA care access part of that care through telehealth. Looking to the future, I am filled with hope and excitement. With advancements in digital health capabilities and the ongoing commitment of our team, we are poised to further expand the way veterans access and receive their care. Together, we will continue to push boundaries, innovate, and ensure that every veteran receives the world-class care they deserve. I'm grateful to my colleagues for their unwavering support and collaboration. This award reflects our shared commitment to service and our dedication to making a difference in the lives of those we are privileged to serve. Thank you very much.
Hi, my name is Kevin Galpin, and I have the honor of serving as Executive Director of Entitled Services in the Department of Veterans Affairs. Years ago, the VA had a vision of delivering healthcare without walls. The ability to deliver our services to veterans in rural communities, underserved communities, in their homes most conveniently to enhance access. And now, thanks to the hard work of many, that has become a reality for many veterans. And that is something I'm incredibly proud of. What I'm most proud of, though, and what touches me the most is the individual stories about veterans that we hear about. We get stories about veterans who have been positively impacted by the services that we've put out. A veteran who got a tablet through our digital divide program, or was able to connect with their provider from a convenient location. When those come through, it makes all the hard work worth it. So today, what I'd like to do is accept this Service to the Citizen Award on behalf of all of those people, both inside the VA and outside the VA, who are making this happen. To the providers who go above and beyond every day to deliver the services, to the innovators that are pushing boundaries, to leadership and Congress, the administration, our own organization, who are enabling us to deliver services in a better way, to move forward this transformation, and ultimately realize this vision of delivering accessible, world-class services to those who have served us. So, thank you all.
For nearly 100 years, the U.S. Department of Agriculture's programs have helped rural economies grow and improve the quality of life for rural citizens. Today, USDA's Rural Development administers numerous programs that provide financing and technical assistance to rural communities. Rural Development's strength is its people, who are highly dedicated to serving the 60 million people who live and work in rural areas. Hello, I'm Jackie Ponte-Lazarek, and I'm proud to serve as Rural Development's first and USDA's only Chief Innovation Officer. At the Innovation Center, we strive to improve the reach and impact of RD's programs, making them easier to access for all our rural customers. We've been working on ways to increase transparency into RD's investments and increase engagement in distressed and disadvantaged rural areas. My team and I would like to share with you highlights from two of our projects.
Hello, I am Dr. Jim Barham, Chief Data Officer for Rural Development. The Rural Data Gateway is a one-stop shop for the public to access rural development data by computer, smartphone, or tablet. For the first time in the agency's history, anyone can view and download all RD investments made from 2012 to current projects. The Rural Data Gateway's interface reflects the consideration of customer experience at every level of development, and we are very excited to grow and evolve the Rural Data Gateway in service to rural America.
Hi, I'm Chris Stever, Branch Chief in the Innovation Center and lead on CORE, creating opportunities through rural engagement. The Innovation Center's CORE team helps the RD field operations focus outreach to areas that have been underserved by the agency. Through this project, RD listens to local leaders and residents about their needs and the barriers that block their path to participating in and benefiting from our programs. CORE is active in all states, partnering with nearly 700 communities and more than 2,000 unique entities and people.
At USDA Rural Development, service is a core value. On behalf of our Rural Data Gateway and CORE teams, thank you so much for recognizing our service to rural America.
The Household Pulse Survey, or HPS, is an important program developed by the Census Bureau to meet data needs for informing emerging policy questions in an exceptionally timely way. Conceived in March 2020 to address critical data gaps for understanding the social and economic impacts of the COVID-19 pandemic, it was initially seen as a source for guiding emergency response across multiple dimensions of American life. The initial HPS content included topics on employment and income loss, housing and food security, dimensions of mental health and access to care, and educational disruption. Topics on the infant formula shortage, energy costs, and economic inflation were added shortly thereafter, upon request by other agencies that had no other real-time data source. In fiscal year 2023, Congress enacted funding for the Census Bureau to establish a high-frequency data program and institutionalize the HPS as a permanent data source. The importance of HPS data is demonstrated by their ongoing use by multiple federal agencies, the White House, and the Council of Economic Advisors. The number of federal agencies and programs requesting to partner with the Census Bureau has expanded to 20 since the launch of the survey. HPS data also provides significant value to businesses, researchers, journalists, educators, public health officials, and the general public. HPS data serve as the basis for multiple reports and media stories, often released after each collection cycle. The Household Pulse Survey is one more tool in the Census Bureau's data collection efforts to provide the nation with up-to-date information that informs our future.
Hi, my name is Ashley Sanders, and I am the Director of Analytics and Decision Support here at GSA's Office of the Chief Financial Officer.
Hi, my name is Izzy Metzger. I'm a Senior Data Scientist at GSA.
So Izzy, what did we do to win this amazing Service to the Citizens Award?
Well, Ashley, we built the GovCX Analyzer Toolkit and used it to help our colleagues at the Department of Labor who are running high-impact services. We helped them make sense of the customer experience data that they had been collecting but weren't sure how to analyze. And we found that analyzing the full breadth of available customer data unlocked the potential for new and improved customer experience performance metrics for digital services. For example, we could identify the rate at which different customer groups requested help, and we could understand how critical populations were getting the services they needed. The biggest thing for me, though, is that we went from knowing only what a few thousand people told us about a service to understanding what millions of people needed from these government websites.
Wow.
So Ashley, why did we build the toolkit?
Well, Izzy, as you may recall, GSA Administrator Robin Carnahan challenged all of us in government to, quote, make the damn websites work. Because for millions in the US, access to digital government services isn't a luxury, it's critical. The American people access government web services for everything from disaster assistance to student loans to employment services, which is what we did for the Department of Labor. So we started looking for ways to bring our data science and analytics skills to the problem and found that there was a treasure trove of qualitative and quantitative data, including those solicited surveys and forums that we all know and love, but also emails, chatbot interactions, and search queries. Honestly, megabytes of unsolicited, unstructured data from a wide range of customers, and it was just sitting there waiting to be discovered and analyzed. So, Izzy, where can folks go to find the GovCX Analyzer Toolkit if they are in need of ways of making sense of their own mountains of customer experience data?
So Ashley, this is actually the thing I'm most excited about. This toolkit, it's reusable, accessible, and it's an open source code repository. It has numerous statistical tools and AI models, natural language processing, sentiment analysis, topic modeling, and a bunch more. It's scalable and can efficiently analyze large quantities of data, and it's flexible enough that different agencies can apply it to a range of government use case. And the toolkit can be found on GSA's GitHub.
That's awesome.
And if folks want to learn more about this work, they can check out 3 blog posts on digital.gov.
We have our Decoding Public Sentiment blog post.
We have our Amplifying Customer Voices.
And our latest blog post, which we just put out in June, Unsolicited Data, a Valuable Resource for Digital CX Enhancement.
So Ashley, did we do all of this work on our own?
No, Izzy, we definitely did not. We would very much like to thank our friends in the Department of Labor's OSHA Voluntary Protection Program, Department of Labor's Employment and Training Administration, and in particular the Career One Stop team in Minnesota. We would like to give a special shout out to the High Impact Services Provider Portfolio Manager at OMB, Mr. Bin Zhang. Here at GSA, we'd like to thank our collaborators in the Technology Transformation Service and our partners in the Office of Government-Wide Policies Performance.gov team. And we would be remiss if we did not thank our executive sponsors, Mr. Mike Flowers and Mr. Steve Brockelman. Thank you all.
Hi, my name is Valerie Gill, and I'm the Senior Human Capital Advisor for the Administration for Children and Families, also known as ACF, and I am incredibly honored to be receiving this award. At ACF, the team works tirelessly to support the social and economic well-being of children, families, and communities in ways such as strengthening early childhood initiatives, supporting Head Start programs, providing care for our most vulnerable populations, such as unaccompanied children arriving at our borders, and working to end child trafficking and support trafficking survivors. And at ACF, I am incredibly fortunate to be supported by a senior leadership team, always willing to embrace new ideas, and hiring managers always willing to explore new business practices, which allows me to pursue my passion, which is solving complex human capital challenges and finding ways to bring new talent into the organization, such as building new fellowship programs, acquiring new hiring authorities, and building tools to help managers find the right person at the right time to support this amazing mission. I encourage all federal employees to think about the problems and challenges surrounding them and how they can be a part of the solution. And I also encourage you to think about joining the ACF team, because if you can change the life of just one child, you can change the world. Thank you.
TSA conducted our second passenger experience survey earlier this year at a number of airports across the United States. We collected more than 13,000 responses. The goal was to gather immediate, comprehensive, reliable, and shareable information. The results of the survey were overwhelmingly positive. They emphasized the outstanding performance of our screening workforce and TSA's commitment to providing excellent customer service while performing our security mission. With more on the survey, here is Nikki French, our Customer Service Branch Manager with the Office of Civil Rights and Liberties, Ombudsman, and Traveler Engagement. So the passenger experience survey was conducted at 16 airports across the country, and it was the first time that we were able to go out and collect information that we could actually share with the traveling public. We got volunteers from each of those 16 airports to go out and conduct the survey for us. We had 2 to 3 survey administrators from each of those airports, and they worked throughout those 2 weeks, different shifts and different times to make sure they were capturing, a little bit of everything from every checkpoint, every terminal, every day of the week. We learned that the public is overall extremely satisfied with the service that they get at the screening checkpoint. 93% of people were satisfied with their experience. And even more exciting than that, 94% of people said that they were confident in the TSA officers' ability to keep air travel safe. That one really hits home for me. That's why all of us are here working at TSA, to keep air travel safe, and the public also believes in us. Our goal is to keep these scores up, and we're going to do that by doing continuous training on customer experience and professionalism. We have a new course at FLETC, CX Demystified. We're working on building that and making sure that everyone in the workforce understands that they're public servants and that being professional and respectful and providing a customer service is actually part of their job.
Hi, I'm Doug Anderson, and I'm the Assistant Commissioner for the Retail Program within the Bureau of the Fiscal Service. I have the privilege of leading the team that sells Treasury savings bonds and securities to public citizens. Some of you might be familiar with I-bonds, which Treasury began offering to the public in 1998. An I-bond is a simple, safe, and affordable way for Americans to invest through a loan to the U.S. government. The rate at which I-bonds accrue interest is directly linked to inflation and is recalculated twice annually. In late 2021, as inflation rose, new accounts were being opened in record numbers. Our department of 350 people is typically accustomed to serving 800,000 account holders. Over the course of a year and a half, nearly 4.2 million new accounts were created, and we sold over $44 billion worth of I-bonds. We made approximately $82.2 million in sales daily during those 18 months. On one particular day, we handled nearly $1 billion in sales. We managed to support that increase in demand despite a 4% reduction in our appropriated funded staff. We couldn't have risen to the occasion without our dedicated fiscal service employees, as well as our partners at the Federal Reserve Bank of Minneapolis. They quickly pivoted to meet the increased call volumes, proposing impactful changes to our processes that immediately improved the overall customer experience while mitigating the burden on our call centers. Together, we quickly rolled out informational resources and self-service options, all while avoiding the intense public scrutiny that would have possibly come our way if we had not been able to identify and implement these solutions. I'm most proud that we reduced our call wait times from a peak of more than 1 hour at the onset of the surge to under 2 minutes. The success of the team's efforts in the face of such an enormous challenge reflects hard work, determination, ingenuity, and above all, a deep commitment to serving the public. The team maintained the mantra that anyone who wants an I-bond gets an I-bond, because when people invest in I-bonds, they also invest their trust in us. This work is one of the most personal ways we engage with Americans here at Treasury. It's an honor to receive this award. On behalf of our whole team, I want to congratulate all the other participants and thank Service to the Citizen for acknowledging the work we do to lead, transform, and deliver for the American public.
Hi, my name is Kimberly Wazniak. I'm the National Lead for Age-Friendly Health Systems with the Office of Geriatrics and Extended Care in the Department of Veterans Affairs, VA. The VA Age-Friendly Health System team includes myself, Kayla Lalande, and Inez Valencia Mendoza. Together, we are using innovation, data, and breaking down organizational barriers to provide age-friendly care to veterans. Age-friendly care is needed now more than ever. According to the U.S. Census Bureau, the U.S. population aged 65 and older is expected to nearly double over the next 30 years. Many hospitals and health systems are unprepared to care for this growing number of older adults and struggle to provide evidence-based care. That's where age-friendly health systems comes in. Age-friendly health systems follow a framework known as the 4 M's: what matters, medication, mentation, and mobility. We commit to cause no harm and align care with what matters most to older adults, their family, and caregivers. When implemented together, the 4 M's improve health outcomes for older adults, increase patient satisfaction, and reduce or eliminate unnecessary or burdensome healthcare. VA has set the aim to become the largest integrated age-friendly health system in the U.S. But age-friendly care isn't just for veterans, it's for everyone. In fact, over 4,000 hospitals and health systems around the world are putting the 4 M's framework into practice. Because of our incredible team in VA, commitment from leadership, and dedication from our frontline clinicians, 95% of VA health systems across the U.S. have joined the age-friendly health systems movement. I want to thank our GEC, Geriatrics and Extended Care, executive leadership team, and our supervisor, Marianne Shaughnessy, for their support. I also want to thank the members of our National Age-Friendly Health System Steering Committee and our colleagues in Diffusion of Excellence and our partners at the Institute for Healthcare Improvement and the John A. Hartford Foundation. Thank you. And congratulations to the other Service to the Citizen Champions of Change Award recipients.
I'm Katie Braun, Chief of the Employee Engagement Center and Innovation Specialist at VA Pittsburgh. Congratulations to all this year's award winners, as well as those before us. It is an honor to accept this award on behalf of my team, the team that I'm very lucky to work with. We shine because of each of you. And thank you to those who have recognized the hard work of the Employee Engagement Center. We landed here because of you. With me today, I have Earl Brown, Engagement Specialist, and Anna Hammett, Systems Redesign Specialist. Together, we all agree our most proud moments serving our customer is seeing input turn into impactful results. This is exactly what has happened with the project that we now call Workforce Matters. From the discovery phase, where we heard the voice of the customer, to the co-creation workshop phase, which provided the opportunity to collaborate with our customer to develop solutions addressing the concerns that they raised. We've now seen those solutions come to real life.
Thanks, Katie. Workforce Matters is a pilot program aimed at breaking down the barriers in communication between VA Pittsburgh leadership, middle managers, and frontline staff, creating a more collaborative environment. This program took the form of a virtual communications channel and regularly distributed one-pagers, which led to empowered frontline employees and strengthened relationships and engagement. Over to you, Earl.
Thanks, Anna. Throughout the process and into the pilot phase, employees stated they felt heard, their opinions valued, and grateful there was a space to voice their opinions and ideas. These comments really speak to the mission and purpose of the Service to Citizen Award, which is to excel in delivering impactful services that positively affect the lives of the public. We send a sincere thank you to all the employees and team members who are involved in this pilot. We look to expand Workforce Matters to another work group in the upcoming months to continue to drive change. Thank you.
Hi, I'm Jim Schaefer, the Director of the Survey of Healthcare Experiences of Patients, or SHEP program, in the Department of Veterans Affairs. The SHEP team is humbled to accept the Service to the Citizen Award for using innovation, data, and breaking down organizational barriers. The SHEP program measures patient experiences in 4 distinct healthcare settings: inpatient, primary care, specialty care, and care in the community. We use the CAPS family of surveys, which is the Consumer Assessment of Healthcare Providers and Systems, and is the industry standard. SHEP assesses aspects of patient experiences that the veterans themselves told us were important, things like patient-provider communication, care coordination, and access to care. The SHEP results are shared at all levels of VA and are also publicly reported on the Centers for Medicare and Medicaid Services, CMS, their Care Compare website for comparison to the private sector. VA has made remarkable strides in improving the patient-centered care that we provide to our nation's veterans. And I'd like to share that story with you today. It began in October of 2018 when VA first reported its hospital CAPS, or pronounced HCAPS, data on CMS Care Compare, but the comparison was not very favorable. VA exceeded the national percent of hospitals receiving 4 or 5 HCAPS stars in only 2 of the 10 HCAPS metrics reported. We knew then that Americans' veterans deserved better. The VA took a holistic approach in evaluating and improving veteran patient experiences. For example, VA stood up new program offices to help those facilities struggling to deliver excellent health care and promote the sharing of promising practices. SHEP data was used in innovative ways to develop key drivers and infographics reports, which were shared in hundreds of educational efforts so that VA hospital leadership and staff can better understand and act on their data. The SHEP team helped conduct over 30 consultative site visits, which allowed us to observe processes, conduct walking tours, provide strategic data reviews, and determine the level of support needed to assist these facilities. These efforts resulted in a tremendous improvement in veteran patient experiences. With the April 2024 release of the CMS Care Compare data, not only had VA dramatically improved in all 10 HCAPS measures, but we also outperformed the private sector. The SHEP team is very proud and honored to receive the Service to the Citizen Award and to have played a role in improving patient experiences for our nation's veterans. Thank you.
Hi, I'm Melissa Conley, and I'm the Executive Director for Capability Management and Innovation here at TSA. I'm truly humbled to be a recipient of the Service to Citizen Award. It's a privilege to be recognized along such inspiring leaders. Special thanks to my identity management team. You keep things moving, and I couldn't do it without you. Thanks also to the selection committee for your efforts here today. Advocating and deploying biometric capability, such as mobile driver's license, credential authentication technology, and biometric bag drop solutions to our nation's busiest airports is not just about pushing the latest advancements in technology. It's also about protecting your privacy and civil rights and making sure we, the government, hold ourselves to the highest standards, all while we enhance security and make that travel journey less stressful and more seamless. Thanks again for this honor, and congratulations to all of my fellow recipients.
Hi, this is Ahmad Mangori, CCD Supervisor working with Department of State Coordinator for Afghan Relocation Efforts Office. For the last 10 years, I have been working directly and indirectly with U.S. government to assist immigrant cases. I feel like CARE is my second home now, and I believe working with CARE is one of the biggest achievements of my career. What I love the most about my job is assisting people who have been supporting the U.S. government for decades in Afghanistan. And I believe now it's our responsibility to relocate those eligible Afghans to the United States through the CARE program for a better life as they truly deserve it.
Hi, I am Hamidullah Amir, Call Center Supervisor here at the U.S. Department of State, Coordinator for Afghan Relocation Efforts since 2022. Formerly starting 2014, worked as an immigration supervisor and consular fraud investigator with the Bureau of Consular in Kabul. I love my job because I help AMSITs and eligible Afghan citizens highly at risk and those left behind to relocate them to the U.S. I manage my team through outreach eligible travelers in Afghanistan for a safe and secure relocation to the United States. Thanks.
Hello, my name is Marta Paredes. I'm the training manager for the Department of State CARE Contact Center, and CARE has a critical role in performing meaningful work that has significant impact on eligible travelers to be relocated out of Afghanistan, and I'm honored to be part of this team. Our training team has a combined experience of over 30 years, and in our department, we have these unique opportunities to get to know our new case managers and learn how CARE has impacted them personally. We're passionate about creating material that's going to help our case managers enhance their skills and their knowledge, and this will enable the case managers to effectively assist the travelers through the relocation process. Thank you.
Hello, I'm Maria Bouchard, Director of Transformative Care Modalities, VA Health Connect at the Veterans Health Administration. I'm honored to accept this Service to the Citizen Award and excited to highlight the transformative care that VA Health Connect offers to our veterans. As an Air Force veteran and a family nurse practitioner, I'm passionate about providing our veterans the soonest and best health care. VA is transforming the way veterans access health care. VA Health Connect is part of the continuity of care offered by VA and allows veterans a way to contact VA first for their health care needs. It plays a pivotal role in VA's strategy to expand access to care and the veteran journey. VA Health Connect provides veterans with access to health care via virtual clinical contact centers that are available 24/7. It's a simpler way for veterans, their families, and caregivers to talk with a real person in real time, to make an appointment, speak with a nurse, meet with a medical provider, and get help with prescriptions, all from the convenience of their own living room. I hear examples all the time of how VA Health Connect has saved a veteran's life. VA Health Connect is now handling 40 million calls a year and receives high patient trust scores. This is due to the numerous clinical contact center medical staff members who handle these calls. Their dedication, hard work, and commitment to excellence ensures veterans receive the right care when and where they need it. On behalf of the entire VA Health Connect team, thank you again for this recognition, and congratulations to all the other 2024 Service to the Citizen Award recipients.
The way the IT department serves this dynamic community is by adhering to the town's mission to anticipate, create, and help people. We want to become the city of the future, and we do that by setting realistic goals and plans that are actionable.
Our dispatch and EOC projects were two capital improvement projects that we had over the past couple of years, and both of them really served to enhance our public safety delivery to the community. We doubled the capacity of the dispatch center. We added next generation technology, enhanced the radio services.
We use state-of-the-art AV technology that provides ease of use and stability for our operators to provide the best level of service to our citizens. We have recently upgraded our municipal building to include state-of-the-art hybrid technology. This allows us to live stream council meetings as well as to increase the engagement of our citizens with our public officials.
IT in this environment is a critical part of the tool belt that we utilize to keep our communities safe.
Central to achieving those goals, IT has a roadmap that's built on 5 strategic pillars. We want to delight the customer, achieve economies of scale, drive data-informed decisions through effective data management, prioritize projects and resources to optimize outcomes, and also build robust cybersecurity in all of our IT capabilities.
And in today's world, there's no way to do it without the use of complex IT systems. And our IT department is incredible in working to ensure that we have state-of-the-art and sophisticated systems that are reliable and resilient when we need them to be.
Hi, I'm Allison Espeseth. I'm the Director of Covering Wisconsin. We are Wisconsin's federally awarded health insurance navigator agency, and we've been that since 2014. And we're just thrilled to have received this award. So thank you, and thank you to Community Connect Labs who nominated us. CCL has been our partner in this web chat effort ever since the very beginning. And it's been a labor of love. We started it right before the pandemic, and when the pandemic hit, it was perfect. And ever since we implemented it, it's reached 28,000 users. We've just expanded our ability to reach those that engaging over the web, engaging over a chat tool is how they want to talk to us. So I'm thrilled and thank you.
The value of web chat can't be measured in numbers alone. The ability to connect with those consumers who traditionally have been reluctant to reach out to us over the phone or meet with us in person has been a game changer. We have young adults who don't have very much information on how to find and enroll in healthcare coverage. And through web chat, they have a very simple, non-threatening way to get their questions answered, get the support they need. And having that compassionate, trusted person on the other side of the web chat ensures that these young adults are going to enroll in a plan that's right for their budget and their medical needs. We can invite that consumer to take the conversation offline. And the consumers really appreciate the continuity of working with someone who already knows their story. They feel valued and seen as individuals through using an online tool. And I think that's kind of amazing.
Hi, I am Srirandam. I am a Salesforce Enterprise Architect at Geriatrics. I support the MATS program. I have led multiple Salesforce development teams within MATS, implementing healthcare IT solutions for the Centers for Medicare and Medicaid Services. One of the proudest moments is the technical implementation of the No Surprise Act. The No Surprise Act is a consumer protection law protecting against surprise medical bills, which is the leading cause of bankruptcy within the United States. My team and I collaborated with CMS to implement a seamless and secure solution by streamlining the workflows from the novel-like legislation under a very short period of time, providing a path for consumers, providers, and issuers to arbitrate the costs of surprise medical bills. The scalability and flexibility of our solution has enabled CMS to keep pace with the rapidly growing regulatory and judicial evolution of the dispute resolution process and contributed to the prevention of millions of surprise bills since its inception. We at GDIT are incredibly proud to support CMS's mission, and it is truly an honor to receive the Service to the Citizen Award, and this is a testament for the work we have been doing on this program. I would like to thank my incredible team for all their support, my boss Jenny for believing in me, and the Service to the Citizen Award program for this recognition.
Hi, I'm Shelley Butler, a program director with General Dynamics Information Technology. And I'm Jeanette Cantrell, and I manage the day-to-day tasks associated with the project we're going to discuss today.
We are so honored to be accepting this Service to the Citizens Award on behalf of a Spanish translation tool we built for the Veterans Benefits Administration. GDIT is a global IT and professional services company, and we offer consulting, mission support services across the federal government. One of those examples is for the Department of Veterans Affairs, where we're helping them mail letters to veterans and their families across the world that contain important legal and medical information about the benefits that they have earned.
Approximately 10,000 of those letters are mailed to Puerto Rico monthly. Historically, letters were only mailed in English. However, the primary language spoken in Puerto Rico is Spanish. Therefore, they were traveling all the way to the regional office in San Juan, standing in line for hours before the doors opened, flooding the call center, asking for support translating those letters.
We couldn't do that manually. There are thousands of letters, as Jeanette said, mailed every day. There are also hundreds of form types and templates that had to be maintained throughout the translation process.
As Shelley said, because of the variety of the content in those letters, we couldn't just have manual translation every day as letters were coming in. So we leveraged tools such as AWS Translate. We created a custom taxonomy that took into account Puerto Rican Spanish, which can be unique in some cases, and established a database of language that could be leveraged for any letter coming in.
We started mailing those translated letters last year, and we are proud to say that veterans and their families saw immediate benefits. Where there used to be long lines at the regional offices for veterans waiting for translation services, there are no lines anymore.
It has been an honor working with VA on this effort. Thank you to our veterans in Puerto Rico. Thank you for your service. Gracias por su servicio.
Hi, I'm Dan Pomeroy, and I'm the Deputy Associate Administrator in GSA's Office of Technology Policy. I'm pleased to introduce and congratulate our IT Modernization Division, who've earned this prestigious award through their exceptional dedication, collaboration, and innovation. Their hard work and unwavering commitment to public service continue to create a positive impact in the federal IT community.
Hi, my name's Tom Santucci, and I'm the proud director of GSA's IT Modernization Division. Thank you for this prestigious award. My team supports agencies in developing strategies and skills to optimize their investments in cloud as well as on-prem and data centers. We manage the Cloud and Infrastructure Committee of Practice, which has several subcommittees, including low-code, no-code, agile, IT sustainability. Our federal workforce development also saved $3.5 million in just in FY23 by providing centralized IT training to the federal workforce. And we provide guidance in the IPv6 initiative that guides agencies in transitioning to the new protocol. We have some exciting initiatives planned for the upcoming fiscal year, including our annual IT Modernization Summit, a data modernization playbook, which will be published on CIO.gov soon. And I'm honored to serve alongside such dedicated colleagues. This recognition reflects our collective effort and commitment to public service. GSA's primary goal is to support those agencies that work directly to the citizens they service. Thank you to everyone who made this possible.
Hello, I'm Stephanie Samoska of the FBI's Active Shooter Training Initiative for non-law enforcement personnel. It's called Active Shooter Attack Prevention and Preparedness, or ASAP. It's my pleasure and honor to accept this award on behalf of my team. Delivering this training for the last 3 years and counting has been not just a moment of pride, but a significant era of pride. For the first time, we are informing and empowering people of all ages to exponentially increase their chances of survival in a violent event based on the tenets of run, hide, or fight, and stop the bleed techniques. Law enforcement is trained to go to the fight. The rest of us are not. So then what do we do in those situations? Well, our training provides several options based upon lessons learned from the research of active shooter incidents my unit conducts on an annual basis. At the end of this training, you will be informed of the choices you have, what they each mean, and empowered to then take action as you see fit. The techniques, tools, and tactics discussed in this course are options from which a more robust individual defense plan can be developed in advance of an active shooter incident. When we see the expression on the faces and in the eyes of the attendees when they first walk in the door, some are a little apprehensive. Compared to the expressions they show upon completion of the class, a noticeable sense of awareness and purpose. That is the moment we trainers know that we made a positive impact, an important difference in their lives. So thank you again for this award and acknowledging and recognizing my team's service to the citizen. It has truly been our pleasure to serve. And congratulations to all this year's award winners. It's a joy to be among so many amazing contemporaries.
Hi, I'm Gemma Howell, co-chair of the Federal Mobility Group. On behalf of our entire team, I want to express our heartfelt thanks for being nominated and winning a Service to the Citizen Award. The Federal Mobility Group, or FMG, under the CIO Council, is a community of over 400 members led by mobile and cybersecurity experts from key federal agencies. The FMG's mission is to identify common mobility challenges, develop workable solutions, and create opportunities to share best practices. We focus on mobile security, acquisitions, network infrastructure, and mobile mission enablement. To achieve our goals, the FMG engages with federal agencies and industry to develop knowledge products, host workshops, and encourage federal agency adoption of safer mobile technologies. For example, we've educated senior IT executives on 5G technologies, sponsored workshops on groundbreaking mobile tech, and published mobile guidance for international travel. A recent summit on cybersecurity and emerging tech is one of the many efforts to keep federal agencies ahead of the curve. The FMG's collaborative environment and ongoing efforts has led to the adoption of proven mobile solutions, effective implementation of new technologies, and help ensure American citizens have timely and efficient access to federal services.
I'm Mark Nakash. I'm a director in the Department of Compact Operations at the Millennium Challenge Corporation, or MCC.
Hi, my name is Monica Chavez, and I am a Senior Program Advisor at MCC.
I'm Melissa Griswold. I'm a Director in the Department of Compact Operations at MCC.
Melissa, Monica, and I created the Integrated Program Management Team in response to a simple request from one of our partners in West Africa. They need better tools and training to help them manage MCC's complex grant programs. We've now created a special space in our agency and with our partners, allowing us to share lessons learned, build on best practices, and reduce the uncertainty that comes with fast-paced, complex programs. IPM's project management training and tools helps MCC achieve better outcomes in reducing poverty and creating a safer world for everyone. One big reason we're so successful is the new moments we create with each of our country partners. We discover these aha moments together. I remember a time when someone from a country partner reached out about a schedule being monopolized by a single stakeholder. We discussed how other partners handle these challenges, we created a stakeholder map, and realized that while this person was from a powerful organization, they had minimal influence and impact. They didn't need to attend meetings and could just be updated periodically on relevant issues. It was great to see the team's relief, allowing them to refocus on their work.
One partner was bogged down with too many long meetings. We helped them streamline their progress meetings with just 4 slides, highlighting key information and making management requests clear and direct. This saved them hours each week, and it boosted their morale.
One of the things that IPM does that I love is run scenario games with our partners. We give them a problem similar to one that they face day to day, and then mix up teams from different silos and partners to solve it. The open sharing of their experience in these safe spaces brings a sense of relief. It shows them they're not alone in these problems, and it helps them get more creative and develop concrete next steps in problem solving for the real issues they face. On behalf of our team, we'd like to thank the selection committee. We're grateful to our champions at MCC, our colleagues who support this service, and our country partners who embrace our help and continue as our partners long after their programs end.
We're not afraid to push the envelope. It is great to be able to actually have a job in which you can make an impact on somebody's life.
In our Office of Customer Experience, we really strive to understand our customers. We want to understand their needs. We want to understand where they're coming from.
The Office of Customer Experience works across all agencies at USDA to make sure all facets of customer service is addressed and the outcome for USDA is unlimited.
One of the projects that we've done recently is called USDA Cares. And the goal of this series of initiatives is to provide underserved farmers with the tools, the resources, and ways to connect with each other so they can be as successful as possible.
Feedback was a huge part of this process. We involved a lot of different folks just to make sure that we were taking their needs and their concerns into consideration.
USDA is the people's agency, and our customers continue to get more diverse. I think it's very important to continue to meet them where they are. We got to continue to invest in resources that's going to be able to continue to understand our ever-changing community.
I want the American people to know that USDA really cherishes their experience. We want to leave a legacy where there is a lot of intention and accountability to providing excellent and proactive experience.
Well, I want to take this opportunity to thank the Service to the Citizen team for giving us this award. We really appreciate it.
I think this is just the beginning for the Office of Customer Experience. We're really just getting our feet wet at this point. In the future, we'll be able to impact even more farmers, even more Americans.
I want every community to be able to know and feel and see the impact of USDA. Because if you're helping change the trajectory of someone's lives, that's a huge responsibility. And I don't take it lightly at all.
Hi, I'm Alexander Lopez Perez, a Customer Experience Project Manager at the General Services Administration. My recent detail at the Partnership for Public Service gave me a chance to be part of the ongoing work to connect CX leaders across government. I'd like to share a brief story I think captures a moment from our CX Organization Design Roundtable series. At one of the roundtable sessions, a Chief Customer Officer shared that standing up a CX project can be a lonely journey. Since the Chief Customer Officer role is still new in many organizations, it means colleagues have different expectations about what a CCO does. So we connected this leader with a mentor who shared tools and advice to help build their program. And it worked, greatly helping them shape their CX initiatives. Human-centered design played a big part of the work we did to make this roundtable series valuable to CX leaders. We used tools like a pre-survey and a workshop pilot to create a tailored approach that supported CX leaders, so they don't need to feel lonely on their journey. Knowing the work I did as part of a team that helps make a difference and that helps others carry out their mission motivates me. It reminds me I'm making a positive impact and helping to meet GSA's mission. The Roundtable series focused on organization design, funding for scale, and measurement, enabling leaders to mentor each other and create a strong sense of community and support. I recognize and thank the incredible team behind this project, as well as all of our participants. Our success was due to the cross-agency, cross-sector collaboration with the Office of Management and Budget, the Partnership for Public Service, and the U.S. General Services Administration. Thank you for honoring us with a Service to the Citizen Award.
Hello, I'm Leslie Wagstaff, and I have the distinct honor and privilege of serving as the Director of the Consumer Support Group within the Center for Consumer Information and Insurance Oversight, or CCIO, here at the Centers for Medicare and Medicaid Services. I'd like to take this opportunity to thank the Awards Committee at the Service to the Citizen for their recognition as a CX Trailblazer awardee. I'd also like to say congratulations to all of this year's awardees across the various categories. The work we do improves the consumer or customer experience, which allows our various services to reach more Americans and helps our various agencies meet their respective missions. Here in the Consumer Support Group, we're charged with providing CCIO with leadership and guidance on consumer-related private health insurance issues and serving as the resource for consumer policy and services in support of the CMS mission. Our goal is that consumers receive accurate, efficient, and timely assistance in gaining access to insurance coverage and are empowered to make informed decisions related to their care. We're only able to accomplish this through the dedicated work of our teams. And while I'm grateful for the recognition of this award, I'm mostly excited for the opportunity to be able to highlight the important and impactful work of our teams. So, when I'm asked about my proudest moment in service, I can honestly and emphatically answer that my proudest moment is every day. I'm proud, blessed, and completely clear on the role and responsibility that our teams have in the provision of care to millions of Americans. Our teams provide support to consumers in various ways. We have teams of enrollment assistants who are directly helping individuals and families enroll in health insurance coverage, such as what happens on our enrollment assistance personnel teams. We also have a team of consumer services professionals that are answering questions for consumers related to using their coverage or resolving complex enrollment challenges, because let's face it, healthcare is complicated and sometimes folks get stuck in their enrollment journey and just need expert care to help address their issues. And then, of course, we have the work of our No Surprises Help Desk that works with consumers who have questions around medical bills and works to either help them resolve their issues or at least help them determine the next best steps for them. Now, this isn't the totality of our work, but even in just those few instances I named, I'm surrounded by examples of our team and partners standing ready to assist, serve, and support consumers so that they can be informed and make the best decisions that they can about their care. Our teams take immense pride in the fact that each consumer assisted represents someone or a family that can receive medical care that may not otherwise have been able to, or someone who has a better understanding of their existing coverage and the rights and protections that they are afforded due to changes in laws. And both this coverage and knowledge changes lives. Our assistance enables people to receive life-preserving medical treatment for cancer and other chronic conditions, and it helps those consumers who were facing tough decisions between maybe paying for health coverage or paying for food to get the care that they need. That happened for a consumer in Louisiana who was paying $200 a month for coverage while living on a limited fixed income. She thought she would have to give up her coverage, but through her work with the Marketplace Assistant, she was elated to learn that she was eligible for Medicaid and received assistance with getting enrolled on the spot. We also received notes from people who are working with consumers and helping them resolve their issues, and then call our help desk for additional support. We got such a note earlier this year. It says, "I just wanted to thank you so much for your work. It really does mean a lot. I think having answers will help this family move on significantly and let them figure out what other options are in front of them regarding the No Surprises Act. I just wanted to make sure you understood how much we appreciated that. Thank you very much for your time and all your hard work at your help desk. It really helps." We get to hear countless stories of the real impact of our work and care, and that renews our commitment to this work on a daily basis. So thank you again to our team and our partners, and also thank you once again for this recognition, and congratulations to all of this year's recipients.
So the Vet Resources Community Network. So this is what we have curated based on your feedback to really be more inclusive of all types of partners.
You understand better than anyone everything that's out there in your community.
Can you help me figure out how to navigate this next chapter in my life?
I'm delighted to be here at the 2024 annual convening for the Veteran Resource Community Network. This is my second annual VRCN to get to be at, and it's an incredible opportunity to be surrounded by people who are profoundly passionate about taking care of our nation's veterans.
It's really great to bring community leaders from all throughout the United States together in one place to make sure that we're not only not duplicating efforts, but that we're collectively learning from each other as to how we can all better meet military-connected students, student veterans, caregivers, survivors, and their family members where they are so that we can better serve them in their transition. That's why, I mean, to be frank, that's why this matters. That's why being here matters.
Every day, I have the privilege of walking into a place where heroes come for care and comfort. The sign at the front of our Veterans Hospital in New Orleans, Louisiana, reads, "The price of freedom can be seen within these walls." For me, it is a daily reminder that as a lifelong public servant, I serve those who have defended our freedoms, putting country before self. Their sacrifices are my motivation and my inspiration. I'm proud to be part of the Veterans Health Administration, the largest nonprofit integrated healthcare system in the nation. To be recognized with a Lifetime Achievement 2024 Service to the Citizen Award is humbling. I am grateful and honored, like so many. My story of public service has been an incredible and unpredictable journey. I am fortunate to have grown up in VA both as a leader and an individual, serving as a senior executive at the Medical Center, Network, and National Headquarters. I returned home to New Orleans 10 years ago to join the VA team and to bring back VA healthcare to the Gulf South region after the effects of Hurricane Katrina. In true New Orleans style, we proudly celebrate the contributions of our healthcare team, those professionals who are a testament to a promise made and a promise kept. Ours is a team of professionalism, offering quality care, improving access to care, and ensuring safe care to our nation's veterans. Our patients trust us. You see it reflected in our 5-star patient experience rating. Daily, I receive messages from veterans and family members about the excellent service they received while under our care. And as any VA employee would attest, ours is an honorable mission. And this award recognizes our calling to serve those who served us. On behalf of the VA team and more than 65,000 veterans who call the Southeast Louisiana Veterans Healthcare System their preferred healthcare provider, I say thank you.
I'm Alicia Mack, and I help lead the Mack Customer Experience Program. Today, I am joined by the CMS MCE team. We have David Shellum, Leah Lewis, Lee Condren, Gary Wazniak, Paul Zawicki, and our manager, Amy Abel-Mackins, here to thank you for recognizing our work. Hello. We want to show our appreciation to the Medicare administrative contractors who work hard every day to make the healthcare provider and supplier customer experience better. By working closely with them, we aim to find ways to improve the customer experience by understanding interactions with Medicare providers and suppliers. Through our program, we've created a culture that focuses on how parts of our business operations affects the customer experience. Whether it's enrolling providers in Medicare, talking to a provider or supplier about a claim, or holding a provider education event, we know that every interaction matters. We don't just look at what happens after people interact with Medicare, we're also using technology to find ways to make things even better before issues come up. This award encourages us to continue to improve providers and suppliers' experiences. We're honored to know our work is helping to make things easier for those who ultimately provide services to people with Medicare. We're grateful for this recognition. Thank you once again for this honor.
I am Diana Gregory, President and CEO of Gregory's Fresh Markets.
And I'm Isabel Kozak, nurse practitioner and assistant chief of staff for community medicine at the Phoenix VA healthcare system.
In our community, many veterans are struggling to access healthy and nutritious foods. The Veggies for Veterans program is making a difference. We're making a real impact in the fight against food insecurity.
That's so true. Fruits and vegetables have been proven to help combat chronic diseases. It is our hope that programs like ours can be replicated throughout the country. Meet Paul. He's a U.S. Army veteran who said this to me. It's my first time to get a bag. I support my nephew and neighbor, so I'll share this bag and it'll save him a lot of money. And guess what? It's soup for everyone this week.
A U.S. Army veteran, Martin, had this to say. This bag of produce is the difference between having a meal and starving.
Here's Kavika. He's an OIF veteran who told me this. I was anxiously awaiting Veggies for Vets Market today since the last bag was really, really good. I can't drive since I have seizures, so it was great to get fresh produce here today.
I want you to meet Denise. She's a disabled female veteran, and she had this to say. Veggies for Veterans gives a variety of fresh fruits and vegetables that last a week or more. This is extremely helpful, especially in the Arizona heat.
Here's Mike. I was talking to him in our drive-through area, and I said to him, Mike, thank you for your service. And he says to me, for you and for what you are doing here today, I'd do it all over again. That was straight to my heart.
This government and community partnership that has lasted over 7 years has helped address food insecurity for our nation's heroes.
To all our veterans here tonight, thank you for your service.